Hello, and thank you for joining us. My name is Kathy Ermacher. I am the chair of the the Commission on Women and Gender here in Lincoln. And today we're going to have another of our series of Women in COVID. Today, our topic is childcare and the childcare industry. We're really pleased that you could join us today, and we're going to ask our guests to introduce themselves. Dr. Bass, we'll start with you.
Good morning, and thank you so much for having me, Kathy. My name is Dr. Katie Bass, and I'm the Data and Policy Research Advisor for First Five Nebraska. First Five Nebraska is a public policy organization focused on quality early care and learning opportunities for Nebraska's youngest children throughout the state. I'm really grateful to be here today and look forward to the conversation.
Great. Mariah?
Good morning. My name is Mariah Stowe. I'm the owner of Splash of Color Childcare. It's in-home here in Lincoln. We serve 12 children and we have 3 staff. I am so grateful to be here. Thank you for having me.
Lindy?
My name is Lindy Christensen Nader. I serve on the Commission for Women and Gender with Kathy and also on the Women's Foundation for Lincoln and Lancaster County, and I am a sociology instructor at Southeast Community College.
Thank you all for being here today. We really appreciate it. And as Lindy said, both of us are also members of the executive board of the Women's Foundation of Lincoln and Lancaster County. And the Commission on Women and Gender is through the City of Lincoln, which we're really pleased to be part of the advisories and the commissions of the City of Lincoln. But because we have needs for funding for some of our projects, and you're going to be hearing about some of those today, the Women's Foundation is a nonprofit organization that funds these projects. And so today, our program is paid for by the Women's Foundation, and so we appreciate their support very much. When we talk about childcare, we know that childcare is such a critically important issue for all working parents and for our economy in general. And we think that there have been challenges in the childcare industry for a very long time. And so I'm going to ask Dr. Bass to start out by telling us a little bit about the pre-COVID conditions. What were some of the challenges that the childcare industry was facing even before COVID?
Thank you. And yes, I think that's a really important point to make, that this is not a COVID-created challenge, that this challenge existed long before our childcare challenges did. And that when we look at childcare as a business, what we know is that there are very thin profit margins. It's very difficult to keep a business running with the sort of funding that is available, and that it's hard then to recruit people into the industry. On top of that, we know that for childcare workers, the compensation is quite low. The median wage in Nebraska in 2019 was just over $11 an hour. And so many early childcare educators have to rely on public assistance just to make ends meet. On top of that, there's very little recognition for really the work that they do in child development, right? And recognizing that and making sure we emphasize that this is a profession, a very skilled profession that's really important for our future. And kind of related to that then is that there's just not enough care throughout the state of Nebraska. Prior to the pandemic, about 90% of the counties in Nebraska didn't have enough childcare slots for the number of children who needed care. Because one thing we know about Nebraskans is that we're a hardworking group, and that for children under 6 in Nebraska, 76% of those children, all of their available parents are in the workforce. And that number is even higher in Lancaster County, where it's 78% of children in Lancaster County who are under 6 years old, all of their parents are working, right? All available parents are working. So that need is really high in the state, and we just don't have enough slots. And even when we do have enough slots, it can be really expensive for families to afford childcare. We know that a year of childcare for an infant costs more than a year of college at the University of Nebraska. So for a family who earns median wages in Nebraska, they're going to spend about 20% of their income on childcare for an infant, just under 20%. So it's quite a substantial cost to families. So all of this really leads to a kind of larger instability in our state, because one of the things we talk about at First Five Nebraska is that childcare is essential infrastructure for our economy, right? And when we commissioned a report from the University of Nebraska Lincoln's Bureau of Business Research, and what they found is that in Nebraska over the course of a year, and again, this is all pre-pandemic, working parents lose about $489 million each year because of inadequate childcare, either having to take time off, changing jobs or not taking a promotion because of the work that would be required and their inability to find childcare. And then businesses lose about $234 million each year because of absenteeism, right? And employee turnover. You take those combined, and what that means is that the state loses around $21 million in direct loss revenue each year, tax revenue. And so the total direct cost is over $745 million each year. And that doesn't even get to those sort of multiplied costs, right, that come as a result of that. So we know that childcare is an important part of our infrastructure, having quality, steady, reliable childcare. And so that's why we really work for those public policies that promote that.
Wow, those are really some astounding statistics. And thank you for sharing that. But then we know that a year ago, the pandemic hit, and it seemed like it hit like within days. I mean, all of a sudden it was just here and everyone was dealing with it. So give us some sense of what happened then in Nebraska when the COVID hit.
Sure. We know that immediately after the governor declared a state of emergency in March 2020, 675 licensed childcare providers closed their doors for at least one day where parents were unable to access them. Now, again, think about that absenteeism and that long-term effect on businesses. By September 2020, we know that 63 childcare facilities had closed permanently, and that there were still some in September that were temporarily closed. And so we may find that that number's actually grown since September. When we look at data from the Department of Labor, what we find is that childcare workers were in the top 10 occupations of persons who filed unemployment claims throughout 2020. So there were 4,449 childcare workers who had to file for unemployment during 2020 because their work was not available to them at that time. So the effects were immediate. And I think Mariah can probably tell us a little bit more about what that was like on a personal level when you're running a business. But what we saw large scale in Nebraska were immediate and severe effects on the industry that was already unstable, as we mentioned before.
Right. So Mariah, tell us, what was it like for you at Splash of Color? What happened? I mean, give us a personal account of what happened for you and your business.
Yeah, I mean, I think we all know, like, it hit so fast and out of nowhere. You know, one week we were saying, you know, well, we'll close if LPS closes. There's no way LPS would close. Like, they don't close for snow days. Like, there's no way they're not going to close. And then they closed, and we were just like, oh, what do we do? Because we do try to model what we do off of what others are doing. And when COVID first hit, there was no model. There was no, you know, well, these people are doing this and this is what works, so let's do that. That wasn't available yet. No one knew what to do. And so we really, you know, as the owner, I had to look at, you know, do I stay open, you know, with the specific subset of in-home childcare? You know, these families are coming into my home, and for us it's in the basement, so it's a little separate, but there's still, you know, that's a lot of people coming into your home every day. I remember looking at the recommendations of only being in contact with 8 people a day, and I'm like counting, and I'm like, you know, there's 20 parents and there's 12 children, and then I have my staff, and that's a lot. You know, if one person gets COVID, then, that's a lot of numbers that we have all together, and they're coming into our house. And so there was a really strong desire to just close the daycare and, just go without. But I really had to look at, what can we afford to do realistically, and wanting to, stay open for our families that did still need care. We ended up dropping down. We only had 6 kids that stayed because all the other ones, their families were either working from home, and so they chose to keep them home with them, or they just weren't working at all, and so they didn't have a need for childcare. So we went about 3 months with we only had 6 kids. And so then I had to look at, I love my staff and my staff is amazing, but how do I keep them if I can't afford to pay them? And so I did make the decision to continue paying my staff, and they just did other jobs in the daycare when, we only had the 6 kids, so we didn't need to do that. And so, but that was a big chunk. That was something a lot of programs couldn't do. And so they lost their staff. I know I have a friend who was the assistant director at a program, and they said pretty shortly into COVID, we don't have a need for an assistant director anymore. I'm sorry, we're going to have to let you go. And so there was a lot of that happened with, there were also teachers who said they didn't want to work in daycare anymore because, I remember at the beginning there was a post on Facebook that said, you're fine. The only way you can catch COVID is if someone sneezes directly in your face. And it was like, all of us childcare providers are like, yeah, that definitely doesn't happen on a daily basis. Because, toddlers, they don't social distance. You cannot say, okay, we're all going to be 6 feet apart. You be over there, you be over here. They're climbing in your lap. They want hugs. And so it was a really hard decision to stay open, and it still is, because, now we are, able to all be vaccinated and go forward with that. But we still have, earlier this month, my program had to close for 2 weeks because we had a positive COVID test in the daycare. And, it happens. And then you're shut down for 2 weeks and you're out that income. And so to try to stay on top of this is really hard. And I've had a lot of fellow providers in Lincoln and in Omaha who have commented on the fact that they're going to close their programs this year or next year because it doesn't feel worth it anymore, because there's so much work to do, and you're risking your life. You're being exposed to COVID potentially every single day. And so it is just really difficult to do that. And then to look at, like, for us hiring employees, to bring people on who, are going to be exposed to COVID. Well, they want to be paid a livable wage to do a job that is more high risk right now. And so then hiring people is just impossible. I know they recently talked about centers in Lincoln and how there's a major shortage in childcare teachers. If you go click on Indeed and look at the list of childcare programs that are currently hiring, it is insane. And, as we said, the average, wage is only $11 an hour. So how many people are out there that really want to work for $11 an hour in a job that we find very rewarding, but right now is very challenging? So yeah, that's kind of a small part of where we're at.
Now, were you able to access any of the national funding that came through for small businesses?
We were able to get the PPP loan, and then there was a grant that was done in Nebraska, the CARES grant. And so we were able to get both of those. And so that was a huge help, especially for closing for COVID, and being able to keep employees for the PPP one. That was huge to be able to have some funds to draw on, because, employees don't necessarily want to stick around if every time you close COVID, they're losing their paycheck. So that was really nice to have as a kind of a cushion.
Well, that's great. Well, thank you for sharing that, because I think it's really important for us to hear from someone who's on the front lines and on all of the really big challenges that there are. The Commission on Women and Gender, in conjunction with the Women's Foundation, did a survey that we wanted to find out from women in Lincoln and Lancaster County what they were experiencing during the time of COVID. And Lindy Christensen-Nader, who is joining us today, was really instrumental in putting that survey together and is now analyzing the information. So Lindy, I'm going to have you tell us a little bit about the results for that particular survey.
So as Kathy said, we, the Women's Foundation and the Commission on Women and Gender, every several years, we conduct a city and countywide Women's Voices survey. And last spring, we were kind of figuring out that maybe we need to conduct a mini survey about COVID experiences. So that's what we did. We collected data from November 2020 to April 2021. We focused on experiences related to family, employment, health, and housing. Today, though, I'm really going to talk just about the information related to childcare, related to family and work experiences. So we had just under 500 respondents, but the majority of our respondents were between the ages of 19 and 49, so kind of in that childbearing age range, and 70% of our sample are mothers. And among them, 75% had children under the age of 18. So our sample, even though it was, again, just under 500, we had a pretty strong representation of mothers, of people who are kind of in this, intense moment of work and family really colliding in a really, again, intense way. And of those with children, 3/4 reported that their care responsibilities for children increased during the pandemic, either because their infants and toddlers were home with them. Over half of the respondents who had infants and toddlers said that their children were home with them. For those who had school-age children, 20% were remote learning at home. Just under 20% were hybrid, so some at home and some in person, and just over 40% were full-time in-person school. So our respondents, women in Lincoln, were really experiencing this transformation of what work looked like, of what home life looked like, and what their children's lives were looking like in terms of childcare or schooling. And one thing to note about our sample is that the majority were employed, and 80% reported not experiencing job loss during COVID. Some did report that they had a reduction of hours, but most of our sample did maintain their employment, and about 75% of those were able to work in some capacity from home. So we have a sample that is unique in that their work was able to be done from home. We know for a lot of women who are frontline essential workers, they couldn't do their work remotely, and so that's kind of a drawback in our sample, is that we are kind of overrepresented in terms of people who are able to maintain their employment and also work from home. But even still, for those women who did maintain their employment and were able to work from home, their care responsibilities were really difficult to balance with their work responsibilities. We gathered both quantitative and qualitative information. And in some of our qualitative responses, one respondent said that she transformed her work hours to be 9 p.m. to 1 a.m. to accommodate when her children were at home and she was helping them do their schooling. So her workplace allowed her to do her work hours from 9 p.m. to 1 a.m. and then to try to do some more work during the day. And I wish I could write back to her, like, when do you sleep? Or when do like, how do you do those types of things that also take care of your physical and your mental health? Another respondent reported that she had to take unpaid time off due to loss of daycare. And so she reduced her hours, but then she eventually resigned from her job because she was running out of paid time off and unpaid time off, and her employment experience was at risk. So she made the calculation to leave the workforce because she didn't have a reliable daycare source, and also her work was not accommodating for her. So even though she was able to work from home, it didn't last long. And that was something that was really difficult that we saw in a lot of those qualitative responses, was that some workplaces were really accommodating and other workplaces were not. They didn't want to hear any child noises in the background for Zoom, for Zoom exchanges or anything like that. And as Dr. Bass and Mariah noted, the closures of childcare facilities, even temporarily, had ripple effects for these families. So some respondents said that they would then try to find a new childcare provider, but that was really difficult because there were no spots available. Others reported that they were really fearful to go into someone else's home, or being really worried about having to trust the other adults within these extended networks about how safe were other people being. So there was just a lot of concern and worry about what to do. Some respondents described how difficult it was to continue to pay for childcare, even if their children weren't currently at the provider, or if there would be temporary closures for exposure. Some families were still paying to maintain that spot, even if their children were home with them. So there was a lot of difficulties in terms of their childcare experiences. And for other respondents, they didn't have access to their extended family members who provided a lot of childcare, particularly if the grandparents had other family members in their household, or their extended family members were working outside of the home, and then you didn't want that cross household risk. And so basically, women reported significant stress in terms of their childcare experiences. And some of the words that were used were feeling isolated, impatient, fearful, this interruption of their normal and routine life. It was really challenging for everyone, but particularly for families with children.
Great. Thank you so much. I really appreciate that. And if you've been reading anything nationally, and we'll put some links at the end of the program, nationally, we know that there are lots of different speculation, but one of the common numbers is 3 to 4 million women who left the workplace. And the reason is because they lost their jobs. They didn't have an opportunity to get that back to, they weren't able to get back into the workforce. But childcare is really one of the biggest concerns. For us who are working on women's issues, the loss of women in the workplace is immediate for them, obviously, and the fact that they're, missing out on earnings. But the other thing that's important to remember is that down the road, this will have long-term consequences for women, because what you make then is reflected in promotions and being able to get different employment, but it's also long-term for retirement. You forget that women, eventually your Social Security and your retirement savings are all based on how much you work. So we're really concerned for women leaving the workplace. And I think that is something that will have some really long-term consequences, not just for women, but for all of us in our economy and in our culture. We are very grateful for everyone. I want to have Lindy just tell real quickly what her situation was, because she is one of those people who was trying to figure out what she was doing at home. And so Lindy, just give us a quick update on how you're doing.
So I was 6 months pregnant when the governor declared the state of emergency in March. And so I gave birth to my son in June, which was really difficult to have kind of that loss of family support and feeling a lot of that isolation, being pregnant and then birthing during COVID. But there was a big concern about what we were going to do with our 3-year-old daughter, what we were going to do about our son, because originally my mom was going to be the caretaker for my son, but she is a registered nurse. And so she is a frontline worker, and it wasn't going to be possible for her to provide that care because of risk of exposure. And thankfully, my institution was really accommodating for me, but I know for many women that was not the case. So I was permitted to have a fully online course load in the fall. But what that meant was that I had a 3-year-old and a newborn at home with me while I was trying to grade and post announcements and do that stuff. And my husband works from home, but his hours are more standard. He's expected to have 40 hours within a particular time period during the work week. So even though he was able to take vacation time and modify his work hours during the day, the brunt of the responsibility was on me. And that was really challenging to work my full-time job, but also have the kiddos at home with me. And the fall was really difficult. This spring, I was on campus for 2 days, or 2 mornings each week, but that also created some resentment within my department among other faculty members, because some of us did get more accommodations than others. And I know that led to some sour feelings, but I also missed out on opportunities for service, for contact with students. So even though I really relished being able to be home with my kids, and I know that I was incredibly fortunate that my workplace made it possible and that my job was something that I could do from my computer, it still was incredibly and remains incredibly difficult to kind of meet those demands of work and family.
Right. Right. Well, thank you for sharing that. We only just have a few minutes left, and I just want to thank all of you for being here today and for sharing your expertise and your experiences. Dr. Bass, is there any last minute thing that you'd like to add to our program?
You know, I think it's really important what you mentioned, Kathy, about sort of women's long-term employment and what that means, because we do know that there has been substantial recovery, economic recovery, but that women, and in particular women with children, are lagging behind other groups. And it was, you know, early in the pandemic, the reason why people were not working, the most commonly cited reason was for economic reasons. My job is not available to me for one reason or another. But when we look at the more recent survey data for women with children, the number one reason why they're not working is school closures and childcare closures. And so while we have maybe not had as much of that in Nebraska as in other places of the state or in other places in the country, it certainly has had an effect here in Nebraska, and we do still see that effect here. Really
soon we will have also the executive summary of our survey that Lindy mentioned, and that will be on our website. And again, lincolnwomen.org is our website. So thank you very much. And thank you for all of those of you who are viewing. We really appreciate your participation, and we hope that we can hear from you about your own personal experiences. We do have an email, lincolnwomen@gmail.com. We'd love to hear from you as well. So again, thank you very much, and best of luck.